I'm Michael Mallinson from the Canadian Spondylitis Association. I'm at the Canadian Rheumatology Association annual scientific meeting, and with me is Dr. Walter Maksymowych. Dr. Maksymowych, could you provide our audience with a brief introduction of yourself and what you do?
I'm a rheumatologist at the University of Alberta, and I spend the majority of my time researching various questions in ankylosing spondylitis, which is a form of inflammatory arthritis that affects the spine. So my research group conducts a variety of research activities in the field of genetics, advanced therapeutics, imaging, development of new diagnostic tests for arthritis, and in the development of better ways to assess patients clinically.
Thank you. How early after onset can MRI detect the inflammation of ankylosing spondylitis, and how accurate is the prediction of AS from MRI imaging?
That's a very important question, and normally the delay in diagnosis from when a patient first presents with symptoms is about 8 years. Now, with the advent of MRI, that can be brought right down to maybe a year or two. It really depends on how severe the symptoms are, and sometimes it can be even within a matter of months, depending on how severe the symptoms are. But MRI is increasingly making simple X-rays of the spine obsolete.
What are some of the difficulties with MRI imaging?
In Canada, we have, of course, a problem with access to MRI, and compared to a lot of other countries around the world, their access is rather poor. It is getting better, and in some parts of the country now our access to MRI has improved dramatically. We also have problems with interpretation of MRI, because for some types of arthritis there's limited experience in understanding what those appearances look like on MRI. This applies particularly to the recognition of the disease we're interested in, which is spondylitis. So most of the people who come to see radiologists with back pain do not have spondylitis, and so radiologists do not get a lot of exposure to the types of appearances that they see on MRI with patients with this type of arthritis. So the experience and the expertise in recognizing these abnormalities is somewhat limited. In addition, rheumatologists, the specialists who deal with this type of arthritis, also have limited exposure to MRI. There isn't much training in medical school, and there isn't much training in their postgraduate training programs. And so they're not all that familiar with the appearances of this type of arthritis on MRI.
I know it's given rise to some new terminology, axial spondyloarthritis versus ankylosing spondylitis. Perhaps you can just explain, what do we call the disease?
So I think the preferred term now is spondyloarthritis, and that essentially means arthritis of the spine. And we recognize that ankylosing spondylitis is actually too restrictive a term. It refers to those patients who develop a form of spondylitis that's readily visible on X-rays. And moreover, the more severe type of arthritis that's associated with bridging bone, and that gives the rise of the name ankylosis, because that means bridging a bone from one vertebra to the next. We recognize that's on the severe end of the disease, so we wanted a term that more appropriately captures all patients who have this disease, not just those patients with the most severe variant of disease. So spondyloarthritis is a broader term that captures patients with the full spectrum of disease.
What do we know about this disease that we didn't know, say, 5 years ago?
Well, an important, a dramatic development with this disease is that we now know there's about 40 genes involved in causing this disease. And this is really important because it leads to new therapeutic discoveries. For example, one of the genes relates to a molecule called interleukin 23. And some of these names, of course, are a little bit of an alphabet soup of names, but they're important because now we are really at the cusp of having a new treatment available for ankylosing spondylitis based on an antibody that targets this IL-23. And so now we have a whole new class of therapeutics beyond the ones that we have available now that look like they are very effective indeed for the treatment of spondylitis. And so that's a major discovery. The use of imaging is a major discovery, so now we can detect patients much earlier on in their disease course, and at a time when we think we can intervene with highly effective therapies before we have major damage in the spine.
So that's why early detection is so important, because the outcomes could be better.
Important because, of course, we don't want patients to continue to suffer with back pain, to endure poor quality of life. We want people to lead normal lives, and we want to avoid the development of damage in the spine.
Thank you. And you've touched on it already a little bit, but beyond biologics and biosimilars, are there other treatment options in the pipeline? You mentioned interleukin 23 as a treatment option. Anything else happening that
Yes.
is capturing attention?
So now people are looking at highly advanced biological therapies which capture don't just neutralize one molecule, but can neutralize two molecules at the same time, what we call bivalent antibodies. So this is highly sophisticated biotechnology, which allows us to sort of kill two birds with one stone, if you like. And this way we think we can achieve a much better anti-inflammatory response.
It used to be called a man's disease, or a men's disease, sorry. Why is that no longer accurate?
Well, because we're now focusing so much on early detection, we're realizing that there are more and more women who do not have the classic features of disease. In other words, they do not have the X-ray abnormalities that we typically see in males. So now that we've broadened the spectrum of disease and we have better methods for early detection, now we're capturing more women with these milder variants of disease. So I think it's still appropriate to say that males have a more severe variant of disease, but now we're capturing more women with the disease.
Oh, that's interesting. I'm going to turn to a couple of questions now that are about the meeting here. And what do you think is the most exciting and important thing or interesting thing from this year's CRA meeting?
Well, I think now we're getting information about how we might improve on the detection process, and particularly with the use of what we call biomarkers. So there's huge interest in using biomarkers to not only diagnose a disease early, but also to help us to understand which patients already diagnosed are at risk of developing more severe variants of disease. So that will allow more personalized treatment approaches. We know who's going to get more severe disease, then we can introduce highly effective therapies much earlier in the disease course. And this is what we're aiming for in personalized treatment strategies. So I think we've heard a lot about the development of new biomarker technologies right here in Canada.
I certainly have heard a lot about personalised medications in the last year or two. Now, what do you think about the use of social media in relation to patient care and medical research?
I think social media is incredibly important, and it's incredibly important because it spreads important information from informed consumers. I think increasingly people are becoming more confused by just the sheer scale, the amount of information on the internet. And I think it's very important for people who have these various disorders to communicate, and often that ends up reassuring people. For example, when people first have an interaction with a physician and being told that they will need to have treatment with a biological therapy, that elicits a lot of anxiety. And I think if people can communicate with others who have had exposure to these biological therapies and understand that they're actually extremely well tolerated, highly effective, and that a lot of the concerns that are elicited through reading stuff on the internet, it's not really a major issue. And so when people communicate through social media, I think it acts as a way of reassuring them that they're really getting the right information and helping them to experience how they should handle these medications and what they should look for. And it helps to put a lot of important medical issues into perspective.
Well, thank you for that. It was a very interesting interview. Thank you very much.